Hi everyone, I am Nidal Father and I want to present you about the bovine high mountain disease. I hope you enjoy in this presentation. So let's go. Now I want to talk about the bovine high mountain disease. The bovine high mountain disease is the disease occur in the cattle that pasture in the high altitudes, such as 6,500 feet or almost 1981 meter. And as we know, in the high altitudes, the oxygen level will decrease. So, this disease is strongly affects on the cardiovascular and respiratory system. Now, the genetic cases or environmental factors cases in increase this disease. And we have a note, this disease occur for all animal that present in high altitudes but not unequal. Now I will talk about the main case of disease or the bovine high mountain disease. This disease is result for decrease the pulmonary hypoxia that occur in high altitudes. So reduce narrowing pulmonary arterial vessels due to reduced hypoxia and arterial hypertrophy from the diameter of the pulmonary arteries that leads to an increase the pulmonary blood pressure and right ventricular hypertrophy. And now, without interference to reduce the blood pressure that result from decrease the hypoxia. And we have now a note, there is a strong evidence that sensitive the cattle to increase the pulmonary blood pressure caused by inherited hypoxia. So, although the many factors may contribute in occur the bovine high mountain disease, however, the main reason for occur this disease or the bovine high mountain disease is decrease the hypoxia that occur in the high altitudes, and that conversion the pulmonary vasculitis is the nature physiological response to cause decreased hypoxia and can see it in most animal. Now, the narrowing mechanism for transferring its method to transfer the deoxygenated blood to area rich of oxygen in the lungs away from the area that have a small amount of oxygen. And now, initially, the pulmonary vascular diversion is mediated through the pulmonary arteries in the acute stage of hypoxia. So, it may be into altered chemical receptors activity or myocardial metabolism also has a role and may be the respiratory disease, viral or bacterial, lead to increase the pulmonary hypoxia to high altitudes that lead to rapid emergence of RV failure. And now, often the clinical cases developed into the first 3 or 4 weeks from moving from the low to high altitudes, and maybe this 3 or 4 weeks the average time for this. Now I will talk about symptoms for the bovine high mountain disease. And as we know, every disease has a symptoms. So the symptoms for the bovine high mountain disease is 1. Non-contagious swelling for edema fluids in the muscle adjacent to the sternum and the ventral side of the body and submandibular region. Number 2. The injured animal be depressed and reluctant to move. Number 3. Jugular veins usually appear and become prominent. 4. Usually diarrhea occurs result to increase the pulmonary blood pressure. Number 5. And with disease progression, the infected animal collapse and lead to death. The affected animal. Sorry. Finally, I will talk about the treatment and the prevention for this disease or the bovine high mountain disease. Now, there is no finally serological test for the bovine high mountain disease. So, the prognosis may depend on the clinical findings correlated with heart failure. But to prevention of this disease, we should transfer the affected animal to low altitudes, and this maybe is a general supporting treatment. Also including diuretics, photosynthesize antibiotics, and appetite stimuli such as vitamin B. And we have a note: the photosynthesis is the only treatment that significantly improves its animal's chance to survive. Now finally may be the treatment for this disease or the bovine high mountain disease not active, so the prevention is preferred. And in the finale of the presentation, thank you for listening to me, and I hope have a nice day. Bye bye.